Hi, my name is Alex, and I'm one of the nurses that is going to be assisting Dr. Dawson with you today. I wanted to give you the results that Dr. Dawson has given to me to inform you. And the dermatologist wanted me to inform you that you have something called basal cell carcinoma. And I know that sounds really scary, but both Dr. Dawson and myself are going to be helping you out in this journey that we're going to be having. Basically, what it means is that the skin has been exposed to too much sun. So the cancer begins in the basal cells of the epidermis, which is the outer layer of your skin. And then in your case, the cancer has been, it's in your zygomatic area or your cheek area. So basically, your cheek has been exposed to too much sun. And it is very rare that the cancer will metastasize or spread throughout the body, so you have nothing to worry about that. But by you doing this procedure, it will remove the cancer from the cheek. And I know it sounds really scary about talking about cancer and all that kind of stuff, but this one is one of the most common skin cancers, and it is very treatable. So the procedure that you're going to be having is something called Mohs surgery. And then the goal for this surgery is to remove as much of the skin cancer as possible. You will not be placed under anesthesia, so you don't have to worry about that. But I will be giving you a local anesthetic in the place where the procedure will be done, so in this case your cheek. But before giving you the local anesthetic, the doctor will mark your skin just so he can get a layout of the area that he can work with during the surgery. The surgeon that will be performing the surgery is Dr. Dawson. And like you know, he is a dermatologist, which means that he specializes in diseases and conditions relating to the skin. He had to go through a lot of training to do this surgery, and so you are going to be in great hands when it comes to the whole procedure. The surgeon will do a local incision and will remove a specimen or a layer of the skin, and I will put a bandage around it. But if there's a little bit too much bleeding, he will cauterize the blood vessels of that area, and he will basically dye the skin and look under it in a microscope just to see if there's any cancer cells remaining, and then by looking at the cancer cells, he will see whether or not where he has to do another incision again. By him, I know it sounds really scary about cauterizing, but it's just to make sure that you don't have a hematoma or a blood clot that will occur in the cheek while we're doing the procedure. The procedure it will keep occurring until there's zero cancer on your cheek. I know this procedure seems very time consuming, but it is essential that remove all the cancerous tissue as well as leaving as much healthy tissue as possible. So it just depends on a case-by-case basis whether the time of the surgery will be. After the procedure is done, the surgeon will put some sutures on your cheek. The sutures are very small and absorbable. So if you feel like a suture is popping, there's no worries about that, because it just basically means that the skin is absorbing them. The only main complication that you might be seeing is minor bleeding. If you see that, just grab a handful of Kleenex and just put it on the area. There are a couple of restrictions that you are going to be in the first couple of days, and that's when I'm going to talk to you about the wound care. So for the first 24 hours, we do not want you to do any exercise. Ice the area 10 minutes every hour on the hour just to reduce the swelling. Take the pain medication that the surgeon has given you. The first one has to be done with food, and then the second time just do it before we go to bed. Another major thing is do not change your dressings, and you cannot get the area wet for 2 days. The surgeon will remove the sutures 7 days after the procedure. So after we're done talking here, we can just schedule that appointment. And then for your follow-up appointment, he wants to see you in 6 weeks just to see how the area is healing up, how this suture location is. and also if there's not that much, if there's still some scarring left, what the options are for you, whether it be laser treatment or dermabrasion. And then basically the goal for those two procedures is to improve the appearance of the skin and just to minimize as much scarring. I know it seems like a lot of information, but the doctor wanted me to give this to you now, that after we're done with the surgery, you can just have a speedy recovery and just take care of the scarring and all that kind of thing, all those kinds of things. So if you have any questions about anything, whether it be about the procedure or the wound care, please do not hesitate and call the office. And after this, we're going to be scheduling your sutures removal and your follow-up appointment. So